is there anything that you would like to ask me?
Yeah.
Can I take in from you so that I come back to you?
When you're working with your patients and you're working with ritual, how do you work with them? Do you have a class or one-to-one?
Yes, it can be in a group or one-to-one. Metamyth, which is a psychological technique based on drama therapy and mythology, as I said before, has a kind of set way of doing things. So I believe a lot in movement, and particularly with epilepsy. What the chapter I've written in the book is on epilepsy and metamyth. People who are having seizures, they do a certain kind of movement, and this is they can do a lot of movement in the generalized clonic tonic seizures, or they can do smaller movements or absences, like they would lose their concentration for a moment. Scientifically, this is still a seizure, but has not the dramatic effect of the tonic-clonic seizure, where the patient lies down and they kind of having muscular and tonic movements. Taking it from there, I believe that it's a good thing for everybody, but in a therapeutic session, we start by looking at our bodies a lot. And there are ways of doing that with the mind and body techniques. So, unconsciously, I believe that if we even imitate the movement of a tonic-clonic seizure in a relaxed way, I believe that unconsciously this will work in somehow. So there's more awareness when this is happening, and the person does not remember what has happened to them, but by doing that or discussing about it or really doing it, and not only that, but imitating some kind of strengthening or relaxing, or lying on the floor. I have some ways. I hope, and I've seen some results, that well, the ultimate would be the ultimate, how can I say, not success, but goal would be to be able to stop having the seizures. But this isn't possible. My technique always works in conjunction with the medicine, where they do have to take some drugs. But when I started, I was hoping that I would be able to get there, so that my technique will help everybody to stop having the seizures. Well, it doesn't, but it helps them get less seizures, and it helps them also to integrate the personality, the seizure personality with the non-seizure personality, so that it does not, they feel they are one person with one condition, and this is okay. So we prepare everyone to accept their condition and to kind of be cool about when people discriminate them. But believe a lot, and what we practice is the relationship with the therapist that we create. And this is why you'll see in the book, the ones who have them, I call my technique Metamyth. And this is a Greek, I put together two Greek words. The word meta is, it means in modern Greek, together with, and it also means after. So it's after the myth and together with the myth. And it, as I take it, and I believe that we create in the session a myth together with the people. This particular time and every time. So we go along with what we're creating together with the myth, and then after the myth we discuss, we have feelings, we work it with ourselves of what has happened, and it takes time. Metamyth and in relation to these particular conditions take a lot of time, and the word meta really describes that. Anything else?
It's amazing to see the kind of fusion, the kind of marriage, the kind of dialogue that's happening here, starting with Sue Jennings, pioneering work with going across to Malaysia, and you particularly, because I'm very excited to see how the origin of Greek theatre and the Greek mythology is such a big vessel to borrow from. I come from a Tamil tradition, and I know that there's so much there. My precise question to you is, how do you go about this fusion? Where do you borrow, where do you leave, where do you exclude, where you include? Because there's so much of need of this cross-cultural psychiatry that's so much needed today. And therefore, in your own experience, this is what I wish to learn, is what do you include, what do you exclude? Is it the structural thing that you include in Metamyth, or is it the content? Just comment whatever you like to comment on this dialogue.
Yes, thank you very much. I think it's a lifetime process, and it never stops. Every time you have the session, the more you learn, and the more I put myself in the situation exactly like the one you described, like where to stop and where to open and where to stop, and when to do what inspires you, but maybe not now. It's not a good moment. We wait until another time. Always having in mind the people and the circumstances. What's most necessary for the people who are interested to do this work as therapists is that I find it's very helpful to know the medical situation quite well, just in case a seizure occurs when you are with the patients, or to know how to handle it, and also to make a specific treatment for them. It's very personalized. In a group it works differently, and it depends if you have in a group people who have the same kind of epilepsy, or they have different kinds of epilepsy. So it needs a lot of preparation, and yes, it's always, but in drama therapy, in every psychotherapy, or this is where the therapist always is, this is where you find yourself. Always you have to think critically with your heart, first of all, but then your mind should not stop working as well, because you have the responsibility of, it's up to you to know where to stop and where to start. But the orientation, my personal orientation,